Hello to everybody, my name is Petrovcic and this is video diary for Rural Health Conference in Dubrovnik. I will talk a little bit on things I learned volunteering in the rural setting. I will talk on what we students can benefit from being engaged in rural health and what we can benefit from practice in rural hospitals. Just before I start, let me introduce myself and also my country, Slovenia. So who am I? I am a fifth-year medical student at University of Maribor School of Medicine. My experience mostly are based on volunteering at emergency practice in a small rural town, which has a big rural background, and I'm also researching on the topic of rural health. And I live in Slovenia, which is a small Central European country with the population about 2 million people, and it is quite rural and diverse as there is a lot of mountains, lakes, there is seaside, and rural medicine is mostly provided by family medicine practitioners, and a lot of them are quite away from bigger city centers. And the interest in rural health in Slovenia is getting bigger and bigger. So let me begin. My biggest experience and biggest difference I noticed is that there is a lot more of hands-on time. You can do a lot of things alone and supervised by your mentor if you are having some practice in rural health. And you can actually feel yourself useful working in this kind of practice. Mentors are happy to see young students being interested in rural health, and they're more than happy to teach you different skills. And as there is more time and less patients than in big hospital, for example, you can really try and to do different procedures. And also the pathology is quite diverse. The next thing is from basics to high technology. For example, in rural practice there is overall no sophisticated diagnostical technology, and your propedeutical skills can get really useful and you can practice a lot. And on the other hand, there are sometimes opportunities to get in touch with useful devices, or let's say gadgets, such as portable ultrasound, which is also really interesting and also quite useful. Well, the next big thing is cooperation. Working in rural setting is really adventurous and a lot of things can happen. So sometimes you get in touch with firefighters, with police, with mountain rescue teams, and these are rescue groups which you mostly don't see in a hospital, for example, and you develop sense of teamwork and cooperation. And there is also the way of thinking, which is a little bit different in rural health, because sometimes you have to improvise. You can get really innovative and find different solutions. So this is another great experience. And maybe last thing, working in rural setting is really active, as accidents happen everywhere, even in remote areas. So you never know what the new day will bring and where you will need to go. So you can go from lakes to mountains. So here are my conclusions and the most important things. There's a lot of hands-on training for students. There are really challenging problems in rural healthcare, which you can also compare and bring some experience to your urban practice. There are a lot of opportunities for research, and it's awesome. So thank you for your time, for your listening, and goodbye, and see you in Dubrovnik.